Hi, I'm Dr. Smita Ramachandran. I'm a senior consultant, Pediatric and Adolescent Endocrinologist at Venkateshwar Hospital, Dwarka. Today I want to talk about signs and symptoms of early puberty in girls. So, what is puberty and when is it early? Any appearance of secondary sexual characteristics in girls or boys is early puberty. If it is before 8 years in girls, it's considered precocious puberty, and less than 9 years in boys is precocity. So, puberty is said to be started when any of the following features are present. In girls, mostly is seen with breast budding. So, breast budding can just present as pain in the breast, which can be starting on any one side or together at both the sides. Other than this, there can also be start of hair growth. Mind you, hair growth only in the underarms area or in the private parts. Hair all over the body is not considered a part of puberty. Additional signs which are common to both boys and girls is a sudden spurt in height. So suddenly over a period of 6 to 8 months, the children will become very tall. Other thing is mood swings. These children can sometimes develop mood swings. They can become argumentative, they can answer back a lot, they can become very recluse. So all these are early signs of puberty in boys and girls. So the cause of early puberty can be multiple. Most commonly seen is familial when there is a history of early puberty in one of the parents. Any cause affecting the brain, a tumor, trauma, infections, surgery, radiations can cause early puberty. Hormonal conditions affecting the adrenal gland can also cause early puberty. But by far the most common is there is no underlying pathology. It is a conglomeration of multiple factors which lead to early puberty in children, which we are seeing of late an increase in the numbers both in boys and girls. So the problems associated with early puberty can be emotional and physical. What we need to remember is if it is early, the emotional aspect is more prominent in girls because it leads to early periods, and these girls are way too young to deal with periods, understanding it and managing it. The second important factor which is a cause of worry are the physical changes. So what happens with early puberty is the bone age at the rate which your bone grows internally is accelerated. So the time for growth eventually is reduced. So early, you may feel the child is growing very tall and the parents are actually happy about it. But in the cases of early puberty, the final height is actually reduced because the bones fuse much faster. So finally, these kids end up being shorter than the expected potential. So we need to consider both these factors in conjunction when we are diagnosing early puberty, and the treatment plan also depends upon the final outcomes that we are targeting. Yes, early puberty can be treated, but first and foremost, it is most important to find the proper diagnosis of early puberty and to look for underlying causes which can contribute to it. GnRH analogs are the medications which are used to treat early puberty in both boys and girls. These are given as injections over a period of time to postpone it, and once you stop the medication, they have no long-term repercussions and puberty resumes after stopping it. So what we need to remember is the take-home message from my interaction today is both parents and pediatricians need to be aware that early puberty is happening more often than earlier. However, it is not the new normal. It is still wrong. It needs to be caught early and treated early to prevent emotional and physical adverse effects in children. Thank you.